Tuberculosis is very common in our country. Tuberculosis affects all parts of the body except skin, nail and hair. And tuberculosis causes its harmful effect by itself or by immunological reaction. On the other hand, HIV, it will affect all the parts of the body. Nails are also involved, but not the hairs. And HIV usually does not harm itself by itself. Always it will produce the immunodeficiency, and we are very much afraid of opportunistic infection. If we consider just 2 minutes when the patient is HIV infected, there is viremia. It will last for around 6 to 8 weeks. CD4 count will be less. Patient will have rhinorrhea, body ache, fever, loss of appetite, like that, just like any viral fever. CD4 cells will be very low, even it may be 200, and gradually body immunity will come up, and patient will go into the asymptomatic stage, which may persist from 3 to 8 years or 10 years or 12 years, like that. Depends upon how much the CD4 cells are being reduced from the normal, usually 50 to 100 or 150 cells per year. And after 8 to 10 years, patient will have a symptomatic HIV infection, and when there will be the opportunistic infection, we will call as AIDS. So what Dr. Basu has told already, if we consider in the medical terms, medical side, if the CD4 count around 500 to 300, then any sort of bacterial infection, tuberculosis, herpes, candidal infection, like that, what he has told, that herpes may either herpes simplex or herpes zoster. When the CD4 count is around 250 to 100, then you will get the pneumocystis carinii infection, toxoplasma, cryptococcus, cryptosporidiasis, like that. And when the CD4 count is less than 100 or around 75, then you will get this CMV infection. CMV, not only retinitis, it may produce the pneumonitis, it may produce the CMV encephalitis, it may produce the CMV esophagitis, CMV hepatitis, like that. It may produce the CNS lymphoma, histoplasma. So it depends on the CD4 count, basically. So that is one chapter regarding how the opportunistic infection according to the CD4 count. That is one way. Another, as a whole, eye involvement in HIV. HIV itself will produce the ischemic vasculitis, and patient will be totally asymptomatic, maybe symptomatic, but usually asymptomatic, and it is an accidental finding. And usually the patients who were suffering from HIV annually, we should send the patient to ophthalmologist for checkup. And there will be typical cottonwool appearance, and patient will be maybe totally asymptomatic. On the other hand, if the patient complains that there is a dimness of the vision, there will be the flushing, there will be floaters, then even at that time it may be around 100 CD4 count or 75 CD4 count. Then we'll get the typical hemorrhagic exudates, what she has shown around the vessels particularly. But it is usually painless progressive, maybe bilateral, and one eye may be affected more than the others. But if the patient complains of pain in the eye, then we should think whether he is suffering from this herpes simplex or herpes zoster. It is a very acute emergency. Patient may lose his eyesight. Treatment should be very energetic by acyclovir. Other infections, even there may be pneumocystis, girovecin infection of the eyes. There may be toxoplasma, what she has told. Kaposi sarcoma may occur. That is another important anterior uveitis due to the syphilis. Another what I am very much fond of, that is called iris. That is this immune reaction and inflammatory syndrome. This may happen here also. Everybody has a false notion that iris only occurs in tuberculosis with HIV. No. It may happen in anywhere, even in case of toxoplasma infection. As there is a CD4 count is increasing, patient's immunity is improving, so there may be reactions. And particularly during that time, when you are treating the CMV retinitis either by injectable ganciclovir or oral vangalsoclovir, if the patients, we start the heart therapy, as there is a improving in the immunity, so there is chance of iris. So at that time we should not stop. We should not stop the treatment. We should start the steroid, full dose, and gradually taper it. So that is one important point, that is iris. Question is, how long we should continue the treatment? But she has told absolutely correct. The first 2 to 4 weeks, full dose, followed by half dose. And during that time, you start hard, patient will gradually improve. His CD4 count will improve. When the CD4 count is more than around 150 cells for 6 months at least, and the viral load is undetectable, then safely you can stop this ganciclovir or this oral form. And when the CD4 count is less than 100, patient, we should send to the ophthalmologist, see at every 3 months to exclude any involvement either by HIV itself or by the opportunistic infection. Thank you.